we're very conservative in the field in terms of saying, progress slowly, methodically. But I don't want that to be misinterpreted, is that you have to do quality science, because if you don't do quality science, you just clutter up the world with a lot of junk, and it actually, leads you astray, and we've had many centuries of that happening at the present time. But I remember when I was, a very junior investigator at the National Cancer Institute, and I had a young man dying of testicular cancer when I was at the National Cancer Institute as a clinician. And I went to a meeting, the plenary session of ASCO. There were about 600 people there, and somebody roughly my age named Larry Einhorn got up and presented the data where adding a single drug, cisplatin, to other known drugs for testicular cancer was getting miraculous results. And I went back, and we treated that patient with cisplatin, and he had a fantastic response. And this is somebody who was within a few weeks of death from his cancer, and it was just a new piece of information. And I have I'm old, in my long career, I've seen, cancers, go from incurable to curable before. I mean, I've seen, childhood lymphoblastic leukemia, go that way extremely quickly when it happened. Gestational choriocarcinoma was the first cancer that was cured with drugs, and it happened a little bit before my time. Hodgkin's disease, I was there when Vince DeVita and colleagues added a single drug, to existing drugs, and had really curative therapy. So it can happen fast. So don't give up, is what I'm saying. I mean, so don't assume that it's not going to happen quickly. Any of the approaches that are being talked about here, if applied, could have really dramatic effects. But you have to do quality science to get there. That's not a reason to rush into sloppy science, because you're shooting for hopeless situations. So I think that optimism is something we all have to have, and it's something that in our field we don't talk about very commonly because it's not socially, politically correct to be effusive about our possibilities. But in our dreams, we all think that this might happen with our approaches, and someday it's going to happen, and I hope it happens in your time.
Yep, thank you. We've seen this. Even, I was going to say, so Jose can speak to the transformation that trastuzumab represented, without cure maybe, but still. Right?
Yeah, and I'd like to go, so I think Herceptin is a good example, but I'd like to go beyond that. And I think perhaps we are not communicating well enough, because many of the things that we were saying here today on the table, these are approaches that we are testing already today in patients. Not all of them, but many are. And I think that the point that Larry is making is a very important one. Things could happen very, very rapidly. What happened in melanoma, there was nothing out there just 4 years ago. We're not talking about 10 years, 4 years ago. And what Jet was talking about, EP, and other even more exciting therapies, PD-1, PD-L1, etc., this has happened overnight. I mean, we are just sitting at this and looking at the data and say, wow, where is this coming from? Well, it's coming from people working on this for a number of years, but the click can happen very, very rapidly. So, for example, for one, I am extremely enthusiastic about all the immune approaches in breast cancer. This could change the life of many, many women. So this is something that we need to stay tuned. The whole thing that we were talking about, PI3 kinase and metabolism that Neil was referring to, and the Gabe's approach, and I mean, all these are all realities that are happening. So not only, so I guess what I'm trying to say is the same as Larry, but in a different way.
We have to be optimists to do this, and that's true.
Yeah.
I mean, and even if it comes off as conservative and cautious, which I think we are by nature, everybody goes to work really optimistic that today's the day something will change, right?